Hi, I'm Lisa Kowalczyk, Executive Director of the Medicine Hat and District Chamber of Commerce, and I'm joined by our community builders, Wes and Jennifer Paterson, co-owners of Sedona North. Now, welcome to both of you.
Thanks.
Thank you.
Sedona North is really almost a whole health solution as I was looking through the information, because you deal with so many different aspects of health and wellness. So can you tell us a little bit about Sedona North and the services that you provide?
Sure.
So we came up with the name Sedona North because we wanted to bridge what I offer in services and what Jennifer offers in services. Previous to that, I was known as Redcliffe Kinesiology. And so people know me most in terms of those through body work. So correcting spine, migraine headaches, digestive issues, so a whole range of health and body concerns. And then we also offer access bars, so that focuses more on brain balance. So a lot of individuals now, they're suffering from trauma, they're suffering from different mental challenges, and that can help kind of correct right to left brain hemisphere, and lots of people can find calming relief through that. Some other counseling services as well. And with Jennifer, there's a lot of services that she can now provide, pulling from her talents. And so
Okay. So yeah, so as a lot of you know, I'm a registered dietitian by background, and I've worked as a dietitian for almost 20 years in a variety of different population health promotion aspects, as well as chronic disease management and health promotion. And most recently, through my private practice, I have got into doing genetic testing to find out exactly what I can recommend to my clients based on their genetic potential. So it's been really exciting and very motivating for me, because now I can have very, very specific guidelines and recommendations for clients that are very individualized. And there's really strong research to support that people that follow the genetic-based dietary and lifestyle recommendations are much more motivated and able to follow the recommendations than someone that just follows population health promotion advice. So it's motivating for me, and it's also motivating for the client as well. So just like I often explain to it as people, is just like your eye color is different than my eye color. How I metabolize and absorb and store and excrete nutrients is very different than you as well. And so now by looking at 70 different modifiable genes, I can then identify areas that may be a problem for someone. For example, I've had clients that have come in with digestive issues and have tried many different things, and kind of at a stale end of what they should be doing next. And so then we can look at different genes that kind of target whether that's lactose, or whether that's gluten, or whether that's a vitamin and mineral deficiency. And we can look at their risk of those. That then helps narrow down what my recommendations would be, whether that be going back to their doctor for additional tests, or whether that be we implement some diet and lifestyle changes that can help to focus on those particular issues as well. Some other things that we can look at are things like, this one I find really neat, is caffeine. And caffeine can either cause people more anxiety if they have a certain amount of milligrams a day, and also increase heart disease and blood pressure. So I'm going to use me and Wes as an example, as we both enjoy our caffeine. We have a lot of children and a very busy schedule, so we both really enjoy it. But we both had our test done several months ago, and I had just assumed that maybe I would be at elevated risk for the caffeine, just based on knowing myself. And I thought Wes would be a slow metabolizer or wouldn't be affected. And it actually came back the opposite. And so I was having a hard time of how I was going to tell Wes that he was a slow metabolizer of caffeine, because he'd have to cut back. So it's just kind of neat that now I can tell people, okay, like, here's your results. And now this is a map that you can use to then reduce your risk of certain types of, whether that's chronic diseases, heart disease, high blood pressure, and then again, gastrointestinal issues, vitamin and mineral deficiencies.
Yeah, I found it really interesting when I was reading up on the different types of testing that you can do, because it really depends a lot on what the goals of the client are.
Yes.
And what they're looking to achieve. And so you can do the testing specific to, aligning to their strategies or outcomes or goals, right?
Exactly. So there's several different reports that we can run. So the first one is the health and wellness report, and that one does the 70 different modifiable markers that look at vitamins and minerals, the digestive issues, heart disease, and metabolic health, and then also some exercise physiology aspects. But then we also have another one that focuses on fertility. So if we have men or women that have been struggling with fertility, we can run this report because it's very well known. The science shows us that certain diet and lifestyle strategies can improve our chances of fertility. Then we can also run another one on sports and performance, which is really, really neat for our athletes or any adults that actually just want to improve their physical fitness. So, I have a son that is a competitive hockey athlete, and this is just something really neat that we can start looking at for improving their performance and optimizing their nutrition so that they can perform at their best. And then finally, the last one that we can run is a skin health report. And again, this one is really useful information for people that have any types of skin concerns, but also people that just want to have better, improved skin. So fine lines and wrinkles, looking at loss of elasticity, things like that. So we can really, like you said, tailor it to what their goals are for their lifestyle.
Well, and the nice thing about that is between the two of you, you offer such a wide range of services that depending what those outcomes are, you have whether beauty products or kinesiology or nutrition and wellness planning, you really are able to tailor whatever program to the outcomes that your patient or your client would like.
Absolutely. And that's one thing too with the skin health is that like you said, I'm a safer beauty advocate. So in conjunction with that, I can then offer people, well, if you are at risk of the fine lines and wrinkles or loss of elasticity, or, you're struggling with skin conditions like, acne or rosacea, things like that, then I can recommend safer skincare products with Beauty Counter. And so we're also advocating for changes across the whole beauty industry of what can be added to certain products. And we don't allow over 1,800 different ingredients in our products because of either harmful ingredients or potentially harmful ingredients. So I can feel really good that that following within our healing arts umbrella is something that I can really advocate as a healthy lifestyle change for people.
So really for clients, it's just a matter of them giving you both a call and saying, this is what I'm dealing with. You have a product or service or something that can assist me with that.
Yeah, there's a lot of clients that have been coming to see me that will now go and get their report done and start doing, Jen will start consulting them and vice versa. So it really does work as a great blend. Do you care if I share your report, a little thing that you found
sure.
out?
Yeah.
So
I'm an open book.
When I met Jen, and I met her as someone who suffered from celiac disease. And so for years, she was not eating or consuming gluten. And the genetic report comes back with 99.7 to 100% accuracy. I just assume this. Through my practice, I can muscle test things like supplements and food with clients. I never thought to do anything of this sort with my wife. And then her report came back and it showed she had a low risk. So basically she had a 99.7 to 100% chance of not being celiac. So she came to me and asked, well, can you muscle test me with some food supplements? So I gave her 5 blank envelopes, and I said, okay, go put some food in these. I don't need to know what's in what, and then seal the envelopes and then just hand them to me. So she handed me the envelopes, and then I just wrote 1, 2, 3, 4, 5. And I wrote on paper 1, 2, 3, 4, 5. And then so we just did a couple tests, and there's a couple tests that we must do first, otherwise we can get inaccurate reads. So there was a couple corrections we had to do body-wise with Jen, and then we retested with the supplements after those corrections
with the
were
food,
done.
not supplements.
Yeah, with the food. Yeah. Now, so she would just bring that in, hold it to her body, and we would do the muscle test. So 2 produced a weak test, 2 produced strong with, strong without. So we call that so-so. And 1 was actually showed up as beneficial. So the 2 substances that showed up as weak was white flour pasta and shredded cheese. And the 2 that were so-so, so you could eat it, your body doesn't really need it at this specific point in time on the test, was whole wheat bread and gluten-free oat. And the one that was actually beneficial for her at the moment was she crushed up a bit of a couple shredded mini wheats. And she's like, well, why would the mini wheat and not the whole wheat, why would this be beneficial? I said, well, when did you last eat? Maybe your body could use a little bit of glucose and some of that sugar. So she was hesitant, but then we had a barbecue.
Actually, more than hesitant, I was terrified to start adding gluten back, because I know how I would, I perceived a feeling when I ate it. So I just slowly started doing it in a safe environment. And I followed my report like to a T of what I should be doing. And it actually turned out my body was responding more negatively to lactose than it was when I was eating like whole grains. So yeah, it's been really incredible to that I have such a story to then share with my clients that, I need to practice what I'm preaching, and I'm following my report to the T. And when my clients get it done, I say, this could be something you throw on your coffee table and never use it, or you can really implement and see where things are going. And the other thing that I wanted to say with Wes was the muscle testing on like supplements or medications is we can now offer also a pharmacogenics test. So pharmacogenics is basically looking at how your body responds to a wide variety of medications. And I am the furthest thing from a pharmacist. So I never counsel on this report. I always refer out to my colleagues that are pharmacists or physicians and say, okay, I can run this report for you and get it sent to the lab. But once you have the report, then I'm going to send you off, and you can use this as a tool with your pharmacist or doctor to then help narrow down the search of different types of medications that would agree with you or not.
Because the one thing that happens is we'll get clients, well, I know I'll get a lot of clients that are on a lot of medications, and they want to get off medications. They're like, well, can I just start taking this? I'm like, no, you started this with your doctor, physician. So this is where you have to talk with them. But now with that report that Jen explained about, now they have a tool where they can see these are red lights, these are green lights. So now the physician isn't having to guess, because sometimes they'll prescribe this, let's try this. Oh, that didn't work, let's try this. So that's a common practice in Western medicine. So this just adds another tool that they can now take to their family physician and prevent the chance of risk of, issues with medications that could provide harm if they took them. So
you've obviously developed a number of tools that you can assist your clients with, and there's a lot of resources that are available. I want to get into a little bit about your story, because obviously with having very busy schedules, full-time jobs outside of your full-time business, and a bustling household of kids, what kind of tools have you been using to adapt and cope with this pandemic, and adapt your business practices? What's helped you through the last several months?
I'll let you start.
Okay. So one practice that I took on is I started doing morning walks. So I started doing morning walks, and when I do my morning walk, I listen to audio. It might be business, it might be inspirational, but it gets my body moving. So now I'm moving, I'm educating myself, and I'm starting my day on the right step forward. Again, I have to scale back my coffee. So that I thought, oh, that's kind of an unfortunate thing. Interesting thing when my test came back, because it tests a lot of antioxidant levels, is I showed up with a diminished response for SOD and NO3, nitric oxide. Well, years ago, I used to take a green drink when I was more into competitive kickboxing and some of the more sport martial arts. And so I reintroduced that. So I started taking a couple of the green drinks, and I find it kind of curbs my caffeine need or requirement and satiates me. Totally grosses Jen out. She thinks, how could you be drinking that? But my body's actually craving it because I have a different genetic factors.
I prefer to just eat my greens. But anyway, yeah. So anyway, with Wes and his, like, you know, getting ideas motivating when he's getting out in the morning and getting his body moving, just started spinning the wheels of different things that we could do during this COVID. So we actually started making some free video content and putting it up on our website. And we did lots of different nutrition topics, and we did some kinesiology topics. We used our little guy, Alexander, to talk about like infant feeding and things like that, which made it kind of fun when we were introducing solids to him. So there's lots of neat video content that people can access on the website.
Mm-hmm. A big thing we found too, well, I found especially because I was during COVID, we couldn't see people. So we couldn't see people in person, and I do body work. So I'm one-on-one. So that was a lot where it came out well. We could do nothing, or we could start doing something where we're giving back and we're actually supporting mental health in the community. And I really noticed it going to the grocery store, because I'm typically a pretty introverted. Jen's more the extrovert, I'm more the introvert. And I'm like, where did all the extroverts and all the courage people, I'm seeing people looking at their shoes and just this, I'm like, what is going on? You know, and there was a lot of fear. And so when there's a lot of this fear and there's a lot of this build, and it's kind of like, then the economy is going down, and you're just focusing on negative and negative, and you're just stacking that negative, that starts showing up in your physical body. That starts showing up in how you're holding yourself. So when I teach women's self-defense, when I teach courses for people to empower, a big thing is just roll your shoulders back. Just breathe, just look up, lift up, elevate. So if we can start bringing that confidence factor back, McKenna, she'll often get worried about things. So she'll get focusing on events. And so she'll often throw out her K27. So we did a video on that with McKenna being the model and showing how resetting the K27 can help you with things, stimulating your immune system and your immune response, but also pulling you out of depression, anxiety,
Improving
confidence, and that. These spots will get quite sore because that's where the lymph will store. So that's where people are like, man, I got to get this off my chest. So it shows up in our language. I really got to get this off my chest. I'm just holding all this in. And so when we can release that, and so sometimes it's just educating people, you know, that mind to body connection and how real that is. And it shows up all the time in our language, or that person's a pain in my back or a pain in my neck, you know, and then, you know,
I think it's actually butt, honey, but,
or butt, yeah.
You know, but we'll talk about backs instead of butts during this. But
I noticed that McKenna was quite ticklish too in that video.
yes, right in there. Yeah.
She loves that correction.
Yeah, for sure. It's good for her. And then along with that, Wes had mentioned the self-defense. So now that he can get back out there and be teaching the self-defense, it's so empowering to people, you know, when they have, you know, struggled with their confidence and, you know, mental health issues too with the whole COVID situation. So getting people out there and interacting and just improving their awareness and, you know, how they handle things on a personal level.
So obviously for each of you, the mind-body connection, mental health, doing things, physical activity, those types of things obviously have helped each of you adapt and cope with this pandemic and just life in general.
Sure.
What other supports have helped you deal with the pandemic, either financial supports or resources? What are some of the things that really helped you as business owners over the last while?
So the one program actually two programs that we're taking advantage of right now is, the first is the Shop Here program. So we're working with a consultant to redesign our website, because right now our website is Redcliffe Kinesiology, and now we're designing a site that's going to be all focused Sedona North. We were able to tap into the MH Big grant that was offered, and so that was great because we got to work with TAG, and they came up with a bit of a marketing strategy and how we could have the site laid out. And so that was really great. And then we worked with Jennifer Galloway from A Day in the Life Photography, and she came in and took some fabulous shots of our home and just office space and us, what it's like, so people can now, once our website gets launched, it's going to be sedonanorth.ca. They can go to that, and really just through the images that Jen took and the information that they're going to find, the sample reports that they can download, all the pricing will be there. It really kind of speaks to what we do in our practice, where I think there was a lot of confusion before what is kinesiology, or what is that you do? And I found I was often explaining to people, and then I would get people like calling up from the Crow's Nest Pass. It's like, well, my uncle came to you and his back's feeling, so, expanding more than just the word of mouth. Now we think we'll get more reach that way. And we are getting more calls from people. And again, word of mouth is a big thing, and definitely being connected through the chamber gives us excellent opportunities to, as we're gonna run events, come out with new promotions and new informational sessions, the opportunity to present those to the people in our community.
And one thing too, Lisa, that I forgot to mention was that I have a contract with Save On Foods as well, and so we're just piloting virtual nutrition tours. So I'm super excited about that, because that's going to be such a great tool for classrooms to be able to use, sport teams that are, within their cohorts, and they, can't get out of that and get to actually to the store. And then also even just families that are looking to improve their lifestyle as well. So starting November 2020, and we're running till January of 2021, and we're pilot testing these virtual nutrition tours all across the province. So people can go onto the Save On Foods website, and they can request a virtual nutrition tour, or they can also contact me, and we can go from there too.
Very cool. And I'm so glad you guys both decided to use the Shop Here program, because that's obviously going to enhance your brand recognition, your profile, and people's ability to find you as well. So very exciting stuff. And of course, all those events and promotions, we look forward to having those populated on the Chamber's website in the coming months, and getting that information out there. So as you look forward, is there any gaps in support or things that you see our business community still needing? And And what are some of the things that you're looking forward to as you move forward?
One of the big gaps that I think is going to come out of all this is, and I'm going to bring it back to mental health. COVID is more than just a virus. It's kind of become a social disease. And we're seeing that more and more, even with the last self-defense course that I taught. We went through a practice just because I thought it's really important at this time right now, and with some of the events that have happened in the city, to talk a little bit about mental health and really nail that down. And out of a class of 8, 7 of the 8 ladies had issues with a K-27. So things like drug use, alcohol, all of these factors, opiates, I think all of this is going to need to be addressed. Psychological safety and well-being, that's right in the Occupational Health and Safety Code. So that's going to become a big challenge for employers as well. So I think if employers and people can be somewhat proactive and step forward and look at, rather than all this cloud of negative, what is wellness and what is well-being and what is
looking at the whole person.
The whole person and looking at the whole organization, because an organization or business is made up of a number of people. And so one person being off in that organization
can have a spiral effect.
Yeah, and pull down the rest. So, teaching people and that level of education, I think that's going to be things that really, as a community, as a business community, we need to be addressing and not making too light of it, but really getting to that personal level with individuals. And everyone has a personal life, and everyone has friends and family, and everyone has concerns over the well-being of their kids and of their loved ones. And if we can empower people and we can give them better tools to look at wellness, to look at mental health, and what works for you might not work for me, might not work for Jen. So that's when you have a bit of a toolbox. And okay, I'm having this situation, I can pull out this tool, or here's a strategy to cope with this. And the more of these that we can express and we can look at as a community as a whole, as a business community as a whole. And I really think that business is now more open, eyes open to this. So there's a lot of blessings that came out of COVID. And I think we're going to see, there's blessings in this, because now you don't just kind of push it to the side and don't look at it. Like a lot of people that didn't have health and safety plans or even know what a health and safety plan was, now are very well versed in that. And I think there'll be more openness to looking at, when you're sick, you're sick. And your body needs time for rest. When your body doesn't feel well and can't do stuff, there's a reason for that. It's because you should be in bed and you need to rest.
Yeah.
And so paying more attention to those things.
And not only that, but also knowing when to refer. And so, like I said, we feel really strongly about, what other businesses are in our community, that when it is out of our scope of practice and where we know that, okay, we have someone that we can refer you then to that can address this area that we don't specialize in. And we really appreciate that back and forth referral, and really, and I've been really trying as much as I can the last year is to build my network of other professionals to know where to refer my clients to when I can't help them on that certain level.
Mm-hmm. For example, something like personal training. We don't do personal training, so that's not our bag. Mm-hmm. So we can line up your body, we can get your structure. Jen can now look at working with your diet, and based on that nutrigenomics report, it's going to also show things where you're going to be or see the best results in relation to exercise. So now the individual that's seeing both of us can now go and take that report and work with a personal trainer or someone else that has that knowledge and expertise. And so creating those networks is a big goal for us in the coming year for sure.
Awesome. Well, there are lots of little nuggets of information in that for people to take away, in businesses in particular, in terms of taking care of your mental health, your wellness, that mind-body connection, looking at the different financial supports and branding. You've covered off a lot of information. But if you were to offer one piece of advice to another business, what would that be?
Start somewhere.
Yeah, do something.
Do something. And if it doesn't work, then change and do something else.
Yeah.
Like honestly, failure is a good thing. It's not a bad thing. It speaks that it didn't work, and try something else and do it a different way.
Yeah.
Awesome. Excellent. Thank you both so much for your time. If people want more information, I know your website is just in the process of being built. But if they want to connect, I know you said sedonanorth.ca, is that correct?
Correct.
Yeah.
And before that launches, where can they find you?
They can, if they're on Facebook, we have a Sedona North page. We also still have the Redcliffe Kinesiology website up. And then we have a Redcliffe Kinesiology Facebook page. So those are probably the primary ways that they can get a hold of us.
Awesome. And if they can't remember that, then they can always go to medicinehatchamber.com, and you're on our business directory, so
Absolutely.
They can find you there too.
Absolutely. Go to the chamber. We're on the business directory. That's going to be your quickest way.
Thank you both so much for your time today, your insight and the tips for others, not only personally, but professionally. You are both amazing individuals and have accomplished so much. So thank you.
Thanks, Lisa.
Thanks for having us, Lisa.